Hello, everyone. My name is Kayla Valdez, and today I'll be presenting on dissociative identity disorder, also known as DID. This disorder is often misunderstood because of how it is shown in movies and television. So I wanted to focus on what DID actually is, how it develops, and how the Marvel series Moon Knight gets some things right and also gets some things wrong. My goal is to help reduce stigma and increase understanding of people living with dissociative disorders. DID is a trauma-related disorder where a person experiences two or more distinct identity states, also called alters. These states can have different memories, behaviors, or even personality traits. DID is not about pretending. It is a serious condition that causes real changes in daily life and relationships. According to the DSM-5 TR, DID involves identity disruption and gaps in memory that cannot be explained by normal forgetfulness. People with DID may lose time or cannot remember what another identity state did. The symptoms must cause distress or difficulty functioning, and they cannot be due to substance use or another medical condition. DID almost always develops because of severe and repeated trauma during early childhood, usually before ages 6 to 9. The brain creates different identities to protect itself from overwhelming experiences. Disassociation is a survival response. It helps a child mentally escape when they cannot physically escape the trauma. In the Marvel show Moon Knight, we meet Mark Spector and Steve Grant, two identity states who do not share memories. The show also reveals a painful childhood trauma that led to Mark's disassociation. These elements are actually very accurate and match what we know from psychology and DID research. However, media often exaggerates DID, especially when it connects alters to violence or supernatural behavior. Research shows that people with DID are much more likely to be victims of violence rather than dangerous themselves. So while Moonlight gets trauma and memory loss right and the cause of it, it still adds dramatic elements that can reinforce false fears and stereotypes. It's important to listen to real people who live with DID. One advocate said, "We aren't dangerous, we survived trauma." Another person explained, "Losing time isn't dramatic. It's scary and confusing." Their voices remind us that DID isn't entertainment. It is about real survivors trying to heal and feel safe within themselves. There isn't a medication that cures DID, but therapy can help a person improve communication and cooperation between identity states. Trauma-focused therapy and DBT skills are commonly used. Treatment focuses on grounding, emotional regulation, and eventually processing trauma when the person is ready and safe. We can reduce stigma by recognizing that DID is a response to trauma, not something to fear. Instead of judging or making assumptions based on movies, we should look at real science and support survivors with compassion and empathy. The media has a responsibility to represent this disorder carefully. In conclusion, DID is a complex condition rooted in trauma. and people living with it deserve understanding, not judgment. Moon Knight is a step in the right direction because it shows the impact of trauma, but we still need accurate education to replace stigma with empathy. Thank you for listening.